Hi, everyone. Good morning, good afternoon, depending on where you are. I'm Dr. Fahimeh Sasan. I'm KindBody's founding physician. I'm a board certified OBGYN and also serve as our Chief Innovation Officer. On behalf of the entire KindBody community, we want to recognize and honor National Infertility Awareness Week. We recognize that 1 in 6 people, adults, are impacted by fertility issues. And so hopefully some of you have seen some of the other programming that my colleagues have had over the course of the week, and we have one more left tomorrow. But over this week, we've been discussing various aspects of fertility and infertility issues that impact men, women, the LGBTQ plus community, whether it's from impact of age to male fertility, PCOS, endometriosis, a full gamut of conditions. But today's topic, I think, is particularly important to me as a founder, as an immigrant, as and the issue for that is of equity and access. And so we're going to spend the next hour talking about this. We'll have questions at the end, so I do encourage you to please put questions in the chat box, and we'll definitely have time for Q&A. But really welcome all of you and in this important conversation. So KindBody is really built on this mission of recognizing that historically fertility care specifically was available to the top white 1%. And it's really true. For the longest time, it was a cash-only industry that was quite expensive. And as a result, it was truly that really affluent 1% that could afford this care. We obviously realize that fertility issues impact a wide variety of people, and those disparities that exist, particularly from an economic perspective, but also from a racial, from a gender identity, from an LGBTQ plus perspective, from cultural perspectives, are profound. And so we're going to spend, some time talking about various aspects of that. But I think the most important thing I want to relate to each and every one of you, and I wish you could see your faces and that we could engage, is that each and every person on this call, whether you have directly experienced fertility issues or indirectly through a family member, friend, or loved one, we're all impacted in some way. And we just want you to know that you're not alone and that you have options, and that we, as a society, still have a lot of work that needs to be done in this area of healthcare in general, but fertility and reproductive care. And so welcome the opportunity to speak with you. And there's a lot to unpack, certainly more than we will get through in this short time together, but hopefully it kind of gives you the tip of the iceberg. So we'll go on to the next slide. So KindBody specifically provides fertility assessments, and specifically want to highlight its fertility assessments for everyone. So whether you're single or in a relationship, whether you identify as male, female, or you're in a same-sex relationship, if you're thinking about having a family 10 years from now, never, not sure, or you've suffered loss of miscarriage. And so those assessments can be really important for all walks of life. And we do virtual and in-person care. We do egg and sperm freezing, embryo freezing, IVF care, insemination. We talk about LGBTQ plus family building and all the different ways that can happen. Male reproductive health obviously is a really important piece of fertility, genetic testing and its impact. So we're here as really a full service fertility clinic, but not just transactionally. You can come to us even if you're not ready for care yet and just want to learn more. All right. In addition, and I always like to say, if we only take care of sperm, eggs, and uteruses, we've colossally failed you. We have an incredible amount of support, from support groups that are held regularly to additional resources like nutrition, mental health, wellness, recognizing that we have to take care of the whole body in order to address fertility issues. We also have an in-house donor egg and surrogacy program. So we recognize that many families need those services in order to build their families. And so we just want to kind of highlight the comprehensive way that we approach this. All right, so today we'll talk a little bit about facts. We'll talk about social determinants of health, which are obviously really important aspect of this conversation as we talk about health equity. We'll talk about some gaps in the United States, whether it's that African American women are 3 times more likely to die during childbirth and the postpartum period, to the fact that there's certain ethnic backgrounds like Hispanic people who are less likely to even be directed to fertility care. And then lastly, always trying to be an eternal optimist, how do we change this? How can we help this process be improved? And what can we all do as a community to improve some of the equity access gaps that exist? All right, so let's start a little bit with the facts. I mentioned this already, but worth repeating. I think a lot of times when people close their eyes and think about fertility, they immediately picture a pregnant woman or a woman who has experienced a loss, but typically we go to an image of a woman, and I want to change that for you, that fertility and infertility impacts 1 out of 6 adults. And as a matter of fact, we're seeing an increase in male fertility issues. So this is something that impacts society much more broadly than I think we realize. And that's what makes this conversation so important, is to take away some of the stigma that if you've had a miscarriage, if you've had a loss, if you're experiencing infertility, you are definitely not alone. As a matter of fact, this number should show you that it's much more common. And so hopefully as we start talking about it, the less scary this topic becomes and the more normalized these conversations become. All right. Obviously, infertility is common, but it's also important to understand that there's racial and ethnic minorities that are impacted. Certainly, we know low-income individuals are impacted differently. But then let's step back from those two things and talk about rural communities. We know that there's only 1,500 reproductive endocrinologists in the United States. So this is not something that's available in every nook and cranny of America. And so how do we provide access to this care to rural communities just as they are in urban communities? And then sexual and gender minorities and some of the stigmas that exist as the LGBTQ plus community builds families. So we'll talk about that. And then certainly people with disabilities. And this list could go on and on. The key here is that the factors, the biases, the cultural gaps that exist add additional complexity to a topic that's already anxiety provoking and scary for so many people. So I think part of just understanding, and obviously we're going to spend a lot of time talking about fertility and reproductive health, but I think it's really important to understand that part of the challenge here also comes from just the way our medical system is based in the United States. 10 to 20% of health outcomes, like of our health, is actually contributed to medical care. And what I mean by that is great deal of our health is our diet, our environment, our sleep, our exercise, our genetics. So it's only actually 10 to 20% that has to do with like medicine and what you receive care at a doctor's office or at a hospital. And actually 80 to 90% of our health comes from non-medical factors, right? And yet, we spend 95% of the US health expenditure goes towards that sick care, right? So we spend 95% of the financial money in the United States healthcare system towards that 10 to 20%, and very little to almost nothing towards that 90% of our health, which is all the other non-medical factors. And I think that preventative, proactive approach to health is what we think is so important when it comes to fertility as well. So ending this concept of you should try for a year before you see a doctor, or you should have 3 miscarriages before you see a specialist, and some of these outdated concepts that require a very reactionary approach. But I just want to kind of highlight that it's rooted far beyond fertility and reproductive care and comes to kind of some of the systemic problems we have in our healthcare system as a whole. All right, so let's talk a little bit about social determinants of health. We can go to the next slide. So for those of you who are familiar, obviously a person's health can be determined by genetic disposition, by our behaviors, by medical services, and then certainly by our social and physical environment. And I think it's really important to understand that when it comes to fertility, all four of these are really important, whether you're a man or a woman, and regardless of your gender identity, socioeconomic status. And so each one of these becomes really important to identify, to take care of, and to nurture through this process. It's not just one aspect, but all of them come together to create our health and also our fertility health. And then when it comes to social determinants of health, it's even broader, right? Our education and access quality. So what kind of healthcare systems are available to us within our community? Our healthcare and quality, right? What is the quality of access? Even something down to if it's virtual consultations, what's the stability of the internet that you have in your home or where you live? And our neighborhoods, we're finding more and more hospitals closing labor and delivery units across the United States. Obviously, each and every one of you probably lives in a different place, and this may not impact you, but these are real problems we have within our healthcare system. In addition, there's certainly social and community content that plays a role. And some of this is some of those stigmas we just talked about. And then obviously economic stability plays a big role, especially when it comes to fertility, where an average fertility journey, whether it's IVF or as adoption or surrogacy, can cost tens of thousands of dollars. And so all of these factors then play a really important role as we think about this 1 in 6 adults being impacted by fertility, and we talk about equity and access. All right, so let's dive in a little bit deeper, and mentioned this for a moment, but this is information from the National Institute on Health, but we know that Hispanic women are less likely to seek infertility care than their non-Hispanic white counterparts. And that lower use of infertility treatment among Hispanic women is most likely driven, or by a large portion driven, by economic factors. In addition to some cultural stigma that exists that may be higher in the Hispanic community based on just cultural background than exists in white counterparts. And so it's really important to understand that, yes, the economic factor based on National Institute of Health plays a big role, but it's also multifactorial. And so how can we address those financial disparities? How can we address those clinical disparities? And one of the biggest ways we do that at Kindbody, and by the way, these are real doctors and patients that you see on the screen here from our New York clinic. But the way that we address some of those is having an inclusive, welcoming environment, having providers that look like our patients, and then also improving the cost margins and the idea of, can we get employers to cover these benefits? Can we increase insurance coverage for these benefits so that we can alleviate some of the disparities that exist? Continuing on, we know 8% of African American women who seek help getting pregnant, only 8% compared to 15% of their white counterparts. We also know, as I mentioned before, that African American women are 3 times more likely to have a maternal mortality or higher maternal mortality rates than their white counterparts, even if you equate for their socioeconomic status. And that's a really important thing to identify. It's also important to understand that there are just clinical differences that happen and different miscarriage rates, which we'll talk about in a moment. But those are really important things for us to understand, to say out loud, so that then we can, as a community and as people, work to address them. All right. So health literacy obviously plays a big role, and I think one of the biggest reasons, before we kind of dive into what's written on this slide, is just to understand that the majority of men and women spend the vast part of our reproductive life. So if you think about your reproductive life, puberty through menopause or andropause for men, we spend the majority of our reproductive life trying to not get pregnant, right? We have this born fear almost that the moment you have unprotected sex, you're going to get pregnant, and that unfortunately stays with us. And so this focus of of preventing pregnancy and preventing STDs is the core of the education we receive culturally and just as a society. And so that's why even very educated people lack health literacy when it comes to fertility and family building. And so there's some people who are delaying family building because of personal preference and focus on career and higher education and just timing, or waiting to meet the right partner, if that's the case. And helping people understand that delay could impact your ability to have biological children, and there's things you can do to be more proactive and preventative about it. So again, that ties into health literacy. There's also delay in seeking fertility care. So we think that, there's people who think you should try for a full year. And I would argue you should find out prior to trying that everything is okay, right? But also people having cultural barriers, religious barriers sometimes, or going to a provider and then being told, oh, don't worry, you're young, keep trying. So some of that delay in seeking fertility care. And then there's also misconceptions, miscommunication, right? And that exist within our culture and society, and some of the biases that we've already discussed that then impact this health literacy. And I want to really highlight that health literacy doesn't mean people are not educated. You could have a very educated, sophisticated person who lacks this level of literacy as it relates to fertility and the impact on your ability to have children based on age, based on other medical criteria. All right, so to continue that, and we've talked a little bit about this, but then there's some medical criteria. That's what I was talking about. So African American women we have studies to show and can have lower implantation rates, lower clinical pregnancy rates, higher miscarriage rates. Sometimes it's due to higher incidence of fibroids in African American women. And so these are really important things for us to know, and yet then understand that African American women are 2 times less likely to be referred to a fertility doctor than their white counterparts. And so that's where all of a sudden the clinical information we have isn't matching what we're societally or culturally doing. And the reason I have Michelle Obama featured here is Michelle Obama had actually suffered multiple miscarriages, and both of her daughters, who we all know well and were in the spotlight during their presidency, were actually both born of IVF. And it's something she finally shared in her autobiography that she wrote after they left the presidency. But I think it's an important reminder that fertility doesn't discriminate against anyone, and that these are stories that are important for us to share so people know that they're not alone. Shifting gears a little bit, and I've talked about this before, but we know that 63%, this is information based on GLAAD, of the LGBTQ plus millennials have a desire to have biological children, and some through adoption and other forms. But this is a huge increase, at least from a reporting perspective, than what we had seen historically. And it's really important, especially for this community, to not only address it from a gender affirming perspective, and to have providers that also are LGBTQ plus, and to have no barriers to receiving this care, but to also understand that there's complexities like getting donor egg, getting donor sperm, getting a gestational carrier, and in some aspects, especially for a same-sex male couple who has to get donor egg and a gestational carrier in order to have a biological child, the expenses are astronomically different than a heterosexual couple. And so all of those things become barriers to the equity of this. And it's really important for us to highlight as we talk about employer benefits, as we talk about insurance coverage, and beyond. And so a couple of other things just to highlight here is I think there's a lot of, hopefully, I'd like to believe, unintentional discrimination when it comes to LGBTQ plus benefits. So one of the things that we find is that even organizations, companies, government insurances that offer fertility benefits, let's say they offer IVF benefits, will often have things that are unintentionally discriminatory towards the LGBTQ plus community. So for example, if there's a requirement that you must have a medical diagnosis in order to qualify for fertility benefits. Well, how does a same-sex male or female couple I qualify? And so by just the virtue of being a LGBTQ plus member, you're not qualifying for benefits. And I hope that these are unintentional, but they exist. And so one of the things that we have done as a company at Kindbody is bring this to the attention of employers, bring this to the attention of big health plans, and government agencies even, so that they can start changing those qualifications and allow that decision to be made between a doctor and a patient, as opposed to medical necessity diagnoses that, again, oftentimes are discriminatory. Fertility preservation also becomes a really important part when we talk about equity and access. Many transgender individuals are going through either hormonal and or surgical gender changing care, and they should have the ability to preserve and have the access, not only the ability, but the access and financially as well as clinically, to being able to freeze eggs or sperm in order to be able to have biological children in the future. And it's really important for that information to be shared and to be shared locally, and the access of that care to be available, because otherwise, once they go through either surgical or hormonal treatment, they may, not always, but they may become then sterile and then be prevented that amazing gift of being able to have biological children. And so that becomes a really important part, and one of the services that we provide at Kindbody that we think is really important from an equity perspective. So I wish I could see your faces, but I'm assuming that many of you are like, oh my gosh, this is like it's already somber to think about infertility and the impact it has on so many people, but this conversation is making it even more somber. But there's so many things that we can do. So number one is understanding the statistics and understanding how common this is, and then advocating for this and shouting it from the rooftops and normalizing these conversations so that they become less taboo and less behind closed doors, which is very much the norm. But also encouraging people to get evaluated, right? Don't wait for a prescription, right? Don't wait till it's been a year, 2 years, 5 years. Certainly don't wait for that second, third miscarriage. But be proactive, and whether you are a man or a woman, regardless of your relationship status, regardless of even when you plan to have children, be proactive and check your uterus, your ovaries, your sperm, understand your options. Even if those options are understanding the adoption, so that you can fully be aware of and take benefit of the possibilities that are available. And then the last piece is finding resources and being an advocate for yourself. We as a company are working very hard with employers across the country to help improve their benefits, to make sure they're equitable. But there's also lots of state mandates that are happening. So voting becomes so important. This is an election year, not only towards things like Alabama ruling and Roe v. Wade, but also mandates. More and more states do offer fertility services as to be mandated to be covered within the state, but then making sure they're inclusive, and then recognizing that there's grants, there's so many foundations, there's so many opportunities. If finances are one of your barriers, where we can work together to overcome those. And then some of the things that we're doing at Kindbody is offering education, like this time that we're sitting here today, but also offering education through various resources. And if you happen to be here from a special organization or group, we reach out to us. We welcome the opportunity to have these types of discussions in person, virtually, to your employer, to your community, to your special group that you're a part of. But that becomes such an important piece. Having diverse providers. So we, as a company, have made it a point to hire LGBTQ plus providers, to have providers of color, to ensure that we can have providers that look like the people we serve, because we know that there's evidence-based data out there that having providers that look like the patients helps improve compliance and also the satisfaction of care that's provided. We've talked a lot about destigmatizing and normalizing, and then obviously enabling people to then get the care and to advocate for themselves with some of this information. We also think it's really important to know that sometimes we all need help. And so whether it's through emotional support groups and therapists, and recognizing that that there's a whole special area of therapy that's focused on reproductive health, that the type of therapist someone might see for bipolar disorder or anxiety disorder is different than the type of therapist that can provide, you know, insight into a fertility journey or into miscarriages and pregnancy loss. And so we have that level of expertise here. But then other aspects of just helping people understand, whether it's alone or as a couple, that you haven't done anything wrong, that your body hasn't failed you, are really important pieces, and that there are still options, and for people not to lose hope. And so this Kindbody 360 program that we have is kind of an extension of that. We also have nutritionists, pelvic floor therapists, lactation consultants, doulas, and again, all of that is with this idea of addressing not only the emotional stress, but also just navigating the entire process from a more holistic perspective. Other things that, you know, we at Kindbody, so one of the clinics that's featured here is actually our clinic in the Bentonville Rogers area of Arkansas. It's only the second fertility clinic in the entire state. So prior to opening that clinic, people would have to travel to Oklahoma and Texas and surrounding states for care. And so by opening more clinics, we're helping improve access to care. But we're also working with employers, working with government officials, and really being the battle cry for changing some of the inequities that exist, some of these medical necessities that are causing discrimination, and then really, and maybe most importantly, advocating for that preventative, proactive approach to women's health in its entirety, not just about having a baby, but being more preventative about menopausal care, being more preventative about preventing miscarriage and beyond. I think this, when we talk of this, talk is about equity and access, and I want to highlight, and we'll play the video in just a second, but Chelsea and Tyler are two of our patients. They're from a small town in Kentucky called Summershade. This town has 100 people that live in it. 100, 100. So obviously a very rural town. And this, and you can tell just by their image, is a very young couple, and they'll talk about it in a moment, but they had been trying to conceive for 6 years and had gone through 12 inseminations because that was all that was available to them in their community, and that's all they could afford. But then when you think about it, even something that's less expensive, like an insemination, times 12 becomes expensive. And so that's where this equity and access to care starts to become a domino effect, because they're living in a rural area, limited their access to care, and then financially they were limited to access, but then they ended up spending 6 years. And think about the emotional, the mental aspects of that. And then there is a happy ending, which is their little boy here. But let me have, let's play this video, and you can hear their words. Oh, we can't hear the sound.
A lot of providers that specialize in fertility specifically. We had actually tried for about 6 years before coming to Kindbody for IVF. When we looked into getting IVF to begin with, it was going to cost us $25,000, $26,000 just completely out of pocket.
We know that 6 times as many Americans need fertility treatment than can afford it. Part of the partnership with Walmart is they shared our commitment and our mission to create greater accessibility to care.
Once we found out about the Kindbody and Walmart partnership, it was completely covered. Between travel, between food, between the hotel that I had to stay in, our medications, the actual procedures, we were out nothing. From the first time that we went to the Kindbody office, it was just completely different experience than going into like a sterile doctor's office. Like you walk in and you feel welcome. I had the same nurse every time I called. She explained everything and she was willing to just talk and chat. they just like sent everything to us and it was all covered. It was great. Even the supplies with the medications were covered.
Delivering access and affordable, high quality patient care is our North Star at Kindbody. Fertility care has now become standard at the workplace as a benefit.
We had been trying for 6 years, and after 2 weeks of medication, it worked. We had one transfer and we were successful in the first try.
Our experience with Kindbody has been wonderful. I recommend it to everybody, especially since Walmart and Kindbody are partnering.
I'm just eternally grateful for everything the whole program has done. Can't be more grateful.
I had the pleasure of actually being one of the providers that took care of that couple. So that story is always very near and dear to my heart. And I think is just speaks to equity and access in so many different layers. So, but we'll go on to the next slide. All right. So what can you do? I imagine there's, over 40 of you on this call and you come from different walks of life and different aspects. And so I think the biggest thing is to have that one-on-one consultation and that one-on-one discussion and recognizing that based on the many factors, right? Whether it's your cultural, your age, your story, your economic status, there's so many different aspects of it, and really kind of taking those layers of the onion one by one. Reviewing your medical history, talking honestly about your family planning goals, whatever they may be, and then making a personalized step and taking into consideration all the aspects, right? The emotional aspect, the clinical aspect, the financial aspect, and really taking it one step at a time, understanding it can be overwhelming. But if we micro step it, then we can achieve everything together and it can be less scary. And so in order to get started, you can go to kindbody.com. If you have benefits, then /activate. You can reach out to us. You can make appointments directly on our website. We're always going to open it up for questions. If you have benefits through your employer, obviously we can share with you what those are and help you understand how to utilize your benefits. If you don't have benefits through your employer, we accept major medical insurances and also have discounted rates if you are just a self-pay person. So no one is excluded from getting the care, and certainly no one should be excluded from at least learning more about their options. Right, I think we're going to open it up to questions. So I think that was our last slide. Is there one more?
No, that was our last slide. Thank you so
Yeah.
much. Yes, we do have a few questions right now in the chat. Let's see. All right.
If you want to go to the next slide, I think it has the website and phone number and everything for anyone that, or one more. There we go. Perfect. All right. So what are some of the questions? Let's see. I see someone said that they were with an fertility charity and would love to set up time to talk with us. So we will definitely, I can have, if you want to put your email address or give us a call, or I can give you my email address here. I'm putting it in the chat. If you want to reach out, we'd be happy to help you. And I'm not sure if that went through, but hopefully it did, and we'll be happy to connect with you. Oncofertility, for those of you who may not be familiar, are patients who have been diagnosed with cancer, and this really unique opportunity to freeze eggs or sperm prior to cancer treatment so that you can then preserve the ability to have children in the future. And it becomes so important and critical to do that quickly so that it doesn't delay the actual cancer treatment. Okay, is secondhand smoke harmful to fertility? So depending on the amount, sure. So there's very good evidence to show that cigarette smoking can be harmful for both male and female fertility. And depending on the amount and continuous exposure, that can be helpful, and not just for your fertility, but also risk of lung cancer, et cetera. And so there's lots of opportunities, both in local communities as well as nationally with smoking cessation programs. And so we really encourage you to talk to your primary care provider and seek programs, because not only is that going to be important for your health, for whoever is the smoker, but can also impact fertility, but so many other aspects of health as well. Someone said, I'm in Los Angeles and would like to visit your local clinic. My insurance does not cover fertility or infertility care and will deny any claims or coding that says as much. As a 35-year-old plus female, can I come in for women's health and reproductive health? Absolutely. So we encourage you to come and see us, and we can, be very transparent about the cost, the coverage, and work together to optimize the ability for you to use benefits that you do have in a capacity that you can, but also be very transparent about pricing, financial programs that are available, grants, et cetera. So we encourage you to come, and we'll give you that financial assistance one-on-one. Can I speak to the barriers for single females trying to conceive as a single parent? Absolutely. So I think there's so many barriers, right? So one is just the stigma, like right off bat, oh, tell me about your partner. And like, no, I'm doing this on my own. And I think single males experience those same barriers. So just coming to an inclusive environment that honors you and supports you as a single parent who's doing this on your own, but then also helping you with selection, in this case, of a sperm donor, and making sure that you have a perfect match, both based on genetic carrier screening as well as other factors. So we provide that support, right? Not only providing you with vetted sperm labs that you can go to, but also just the process and walking you, step by step through that journey. But I think the most important part is just welcoming you and honoring you as a woman who wants to be a mom, and not creating any stigmas around that. Let's see. It says, thank you for this discussion. What are some creative, cost-conscious ways that companies and Kindbody have worked together to lower economic barriers for non-birthing couples to have genetic children? It's great that donor and gestational carrier services are available. However, the cost remains significantly higher. So some of the things that we are doing is, and that's a huge thing, right? And I mentioned that earlier, right? The cost of a gestational carrier and donor egg is much higher than going through IVF. And so those are things that we're constantly working with companies and helping them understand the equity of their benefits. And it's something that whoever this anonymous attendee, if you want to reach out to us, we'd be happy to further champion with your organization. We also, because we do have our in-house gestational carrier agency and our own in-house egg donor agency, have done our best to lower the cost as much as we can. But your concern is a real one, and we won't hide behind it. And the cost is vastly different. And it's something that I will be transparent in saying we haven't fully solved, but we are eager to partner with you as an individual and with companies and the healthcare system more broadly to try to overcome. It's something that is a challenge we recognize exists. Someone mentioned that they're on Medicaid. So Medicaid, Medicare is a whole special population. In that case, it would be looking one-on-one on grants that may exist, other public funding that may exist in your community, both on a state level or federal level. But that also presents a challenge and is something that I would say needs to be addressed. And that's certainly the benefits provided from a fertility perspective to the Medicaid population are very different than through commercial insurance. And so I would encourage you, Georgia, to meet with us, and let's see what foundations or grants are possible that we can help you, uncover. Let's see. So if you don't see a Kindbody clinic near you, we can still serve you. So we do virtual telemedicine consultations in all 50 states. So we can order labs, we can start your testing. So it doesn't have to be that you have to come to a brick and mortar Kindbody location. We can still start the care. We can also direct you to vetted clinics near you. But I think the most important piece for the person who asked that question is getting started. And a great deal of this fertility discussion is consultative, which we can start on a virtual appointment. And then our physicians are able to order labs and referrals for diagnostic testing, so ultrasound, semen analysis in all 50 states. So you can still get started, and we'll help guide you. Can you tell us more about the Walmart partnership came about? More about grants or financial support, including discounted rates. So Kindbody serves as a fertility benefit manager for a lot of companies. So not just Walmart, but it's something that we go to different companies, big and small, and we champion adding fertility benefits that are inclusive for companies. And so that's part of how that came about. And when we partner with employers, we do have special rates that are then available to their population and special benefits, and they vary from one company to another. In addition, whether you work at a company or not, we can help guide you to financial support or assistance that exists, whether it's loans or low interest loans, things like that that exist in the community. And then also in some cases, especially for like cancer patients, there's also grants that we can tell you about that help you improve that access to care. So it's very much one-on-one based on your financial situation or your needs. Someone said, I know the first appointment can be scheduled virtually. How about appointments after that? Yeah, so we can see you as a first step virtually or in person, and then we guide you. So obviously fertility care can't be done all virtually. So depending on where you are, you would come into either a Kindbody clinic, or we'll refer you somewhere where you can then get your blood work done, your genetic screening done, semen analysis, additional testing, and then obviously the care that you need. So there's options both virtual and in person, and depending on what city and state you're in, we will help guide you to your in-person care. But just because you don't see a Kindbody clinic near you doesn't mean that we can't help you get started, and we'll help direct you to the best care that's available. Can Kindbody services be applied to gestational carriers? Let's see, my company has Kindbody. We were not able to extend those to our previous gestational carrier. Is this a Kindbody policy or company specific? We would need to look at the specific benefits. So if I'm assuming you're talking about a program you had through your company, and each one of those are different. So I would encourage you to reach out to us, and one of our team members could better explain that directly. Most of the policies when it comes to different companies are unique to the company, but we can help you better understand how to use them and the resources that are available. Okay, someone said, I happen to not be in a relationship when starting my fertility journey. This is quite challenging because a lot of providers I see are Catholic and used to seeing patients after marriage. Would Kindbody be a good fit? Absolutely, and I think we've addressed that before. We see people of variety of relationship statuses, socioeconomic statuses, gender identities, different paths of life, different ways of having children. No two are the same, and so we certainly welcome you, and we want to provide the best affirming care, inclusive care that's possible to everyone. And so we certainly hope to see you, and hope more than anything to help you feel seen, heard, welcome, as you should be. Let's see. The San Diego clinic is open and seeing patients actively. So we encourage you to make an appointment with us because it is open now. And let's see, I'm sorry, did I miss any? Here's one. I'm considering egg freezing and would like to inquire about your clinic's specific statistics regarding the success of frozen eggs developing into viable embryos. So the most important, some of the best advances in the field of fertility have been made around what's a process called vitrification. So historically, when we look at 10, 15 years ago, egg freezing technology wasn't very good. And so in those days, embryo freezing was always considered superior. But now with the advent of vitrification, which is now standard in the United States, the process or success of freezing and thawing eggs has dramatically changed. So that is the most important thing. The second is the success of an egg is always going to be most importantly based on the age of that egg at the time it was frozen. So for example, the likelihood of a frozen egg from a 30-year-old to become a live birth is much better or much higher than the likelihood of a frozen egg of a 39-year-old leading to a live birth. And so when it comes to those success rates, it's always important to do them on a case-by-case basis based on the age at which the person is when their eggs are frozen and how many eggs are frozen. And that's something we would love to talk with you one-on-one and help you better understand. We also have a fertility calculator within the portal that you can use to kind of see those statistics. I had work meetings, so I'm joining late. I posted comments on a previous day, but haven't received a response. I am arranged for somebody to provide care for what my insurance covers with no cost to me. So far, I have been told to give credit card info when making an appointment, but I won't pay anything out of pocket. Yeah, so Amanda, if you've already, I guess the best thing to do would be to have one of our financial navigators just talk with you one-on-one. The entry of the credit card is just to hold space. And in case to cover for copays, things like that. It's not that we automatically charge anything, but we're happy to talk with you about that one-on-one. So I don't know if you're able to put an email address in the chat, and we'll make sure that we give you a call back within the hour of this visit ending or this session ending. Or if you already have an account, we can look it up. Oh, there you are. Perfect. So we'll take that and be sure to have someone give you a call or send you an email immediately. All right. Did I miss anything? I wish you guys could talk. I wish I could see you. But I hope that this has been informative. I want to, emphasize that although we talked about a lot of things, we only kind of touched the top of the tip of the iceberg of the amount of information that we could talk about. But I hope that this at least provided you some information. If nothing else, I hope that there was something in this discussion that resonated with you, that gave you hope. And very much this is a personal discussion. So we hope to have the opportunity to meet with you one-on-one, answer your questions, provide you with options, and explore the barriers that you're having from an access and equity perspective and see how we can overcome them. But on behalf of the Kindbody community, we acknowledge that infertility is real. We're here for you. You are not alone. And we hope you have a wonderful rest of your day. And thank you for being a part of this important discussion today. Thank you again. Bye, everyone. Thank you for joining us.